Hi, my name's Amanda. I'm a licensed clinical social worker and I'm a licensed therapist here at the Howe Clinic.
I'm Dr. Howe. I'm the medical director at the Howe Clinic here, and I'm really excited to have Amanda working with us for a lot of reasons, but specifically because of the ability to help people with their sleep. Amanda, talk to me about insomnia and then CBT-I, which is cognitive behavioral therapy specific to insomnia, and then what does that look like? How does it help people? And what could somebody that's coming to you for help with insomnia expect?
Right. So it's important to know what insomnia is, because I think that term is used a lot, with people who don't necessarily have full-blown insomnia. So insomnia is somebody who is struggling with falling asleep, somebody who has difficulty staying asleep, who's waking up multiple times throughout the night, not having that quick, return to sleep. And you're struggling to the point where it's impairing your daily functioning. So it's
Sure.
impairing your mood, your relationships, your performance at work, outside of work as well. So it really has to be something that is affecting you profoundly for, however amount of time.
Yeah. So now a lot of people take medicine to help them sleep. How is this different?
This is different because it's helping people reduce or eliminate sleeping medications. And the reason why is because oftentimes people are overusing sleeping medications. So, generally, sleep medications are only to be used 2 to 3 times a week, but people are usually using them every night.
Yeah.
And the problem with that is sleep medications have usually a pretty long half life.
Yeah.
Most of them are
Meaning
between.
they stay in the body for a long time. Yeah.
Correct. Yeah. So they can stay in your body anywhere from 6 to 10 hours. And that's 50%, right? So that other 50% is still lingering in your body.
Yeah.
So if you're using it every single night, you're compounding the sleep medication. And over time, that's going to affect your cognitive functioning.
Yeah.
That's going to affect your mood. And there's a lot of research, kind of scary, showing that it can lead to neurocognitive disorders like dementia.
Interesting.
Yeah. So a lot of people are trying to get away from sleep medications for various reasons, and CBTI actually helps you do that.
How effective is the technique? Like, how good are you at making people sleep?
Well, I'm great, but no. So it is up to 75% effective.
Okay.
In particular, with medications, that's up to 90% effective. So if somebody's coming in with their main goal of I want to reduce or eliminate, taking Ambien, the efficacy is actually really high.
Yeah.
So it's usually a first choice for providers to send people to get CBTI, if they are overusing sleep
Yeah.
medications or maybe sleep medication isn't good for them now. A lot of older adults, elderly, sleep medications can be dangerous for them to
Yeah.
take.
Interesting.
Yeah.
So when let's say somebody says, "All right, I want to sign up. I want to help with my sleep." What can they expect when they like? How long does it take? How long are the sessions? What do we do afterward? That kind of stuff.
Right. So CBTI is great in the sense that it's very structured. It's 5 sessions. So you do an intake session after you complete some paperwork to allow me to kind of get to know you better. And then from there, you're doing 5 sessions. It's 6-week program because the last 2 sessions are actually biweekly. And then from there, people usually do well for a year or so. Sometimes they need to come back in for a checkup. The checkup is usually only 1 to 2 sessions.
Now, is this when you go to a session for this? Are you dealing with childhood issues? Are you dealing with the things that keep you up at night? What do you do? Like, what do you teach somebody when they come to this? Like, how does it work?
That's a great question. I think a lot of times people think you're coming in and dealing with, the trauma or the stressors that sometimes lead to insomnia.
Right.
CBTI is very focused on just your sleep.
Okay.
So, like traditional CBT, cognitive behavioral therapy, you're restructuring your thoughts
Yeah.
to change your behavior. And in this case, the behavior is sleep or lack thereof.
I know that it's when you're working with a therapist in general, it's best to not have other therapists working with you.
Mhm.
Is this, does this fall into that same category too?
Not at all. So we really want you to continue your therapy, or if you're coming in with, clinical depression or substance abuse issues, we want you to, seek therapy. I can definitely make referrals, because it's a good conjunction. If you're getting that treatment for anxiety, depression that's maybe exacerbating your insomnia, you can get that and CBTI at the same time.
Okay, so it sounds like this is an additional set of skills and tools that somebody can use that doesn't really have anything to do with the talk therapy or the other type of therapy a person's doing.
Right.
And it's hopefully something they can take and use throughout their life to improve their sleep.
Yes. Yeah. It's a little different from traditional therapy because you're not coming in and divulging about, what you're going through in your life at that period or past traumas, like you mentioned.
Yeah.
It's really just focused on your sleep. So, and that's generally helpful for people because insomnia really isn't caused by a stressor. Insomnia isn't a product of a stressor. It's a product of our thoughts and behaviors around sleep.
Interesting.
Mhm.
Okay. How long are the sessions?
They're about 30 to 45 minutes, depending on, if medications are something that, is involved in the therapy, then they'll tend to be a little bit longer because we need to spend some time talking about just the medication component.
So with the things that you do you try to get people off of medications or how does that work?
Yes, so we are tapering off the medications. Depending on what the medication is, you refer to a provider, to make sure that we're doing it safely.
So it sounds like you would try and work with the patient's doctor
Mhm.
that is prescribing the medicines to
Correct.
safely get them to be not dependent on those medicines and to
Correct.
use the skills that you're going to help provide them and help
Mhm.
teach them to then have that be the way they sleep. Is
Yes.
that right?
Yes, that's absolutely right.
Is this something that can be done virtually or do you need to see the person in person?
It can be done 100% virtually. It can be done in person as well. Some clinicians do groups. So it's really all of those options, all of the above.
Yeah. Okay. And so for here at the Howe Clinic, how are we offering this? Is it virtual or in person?
It's going to be virtual and they're going to be individual sessions. I feel like individual gives that particular person just more time to process,
Yeah.
and a lot of times people prefer individuals,
Yeah.
so we're going to start with that. If there's a need for groups, we could definitely move into that later.
Yeah. Is this something that's covered by insurance?
It is. So CBT is widely recognized um, in general. CBT-I is under CBT, so most insurance companies do acknowledge it and authorize it.
Is this something where somebody would need a booster session later on, or how does that work if it's been some time and things aren't working quite as well? How does that addressed?
Yeah, so usually around, 1 year or so, people will need a checkup. So people will come in and do maybe 1 to 2 sessions. They wouldn't need to do the whole program again.
Yeah.
It's kind of just a booster to remind them, about positive sleep thoughts, positive, sleep techniques and habits.
Yeah. Sometimes it's hard to make massive changes right away.
Mhm.
And it makes it easier to reach goals if you break it up into smaller little goals. Is that part of the strategy with what you do, or is it something where you ask someone to make a large change to, all at once?
That's a great question. With the sleep diaries, we're starting small
Mhm.
and we're building up from
Yeah.
there. So you're completing a sleep diary every day.
Yeah.
It takes about 1 to 2 minutes. It's very quick. But you're starting with how your current sleep is,
Yeah.
and then from there you're building on that. So I would say it's small changes. You're not going to immediately, you know, go to bed at a certain time and wake up at a certain time. That's not the goal. The goal is to create a habit that you're going to continue with, not just while you're in a program.
Yeah. All right. Well, thanks so much for all the
Thank
information.
you.
Yeah.
Thanks.